Smoking but wanna get plastic surgery? Let's talk about it. So this is not a video about how you can continue to smoke and get plastic surgery. Smoking tobacco is horrible for you. I don't even want to go into all the things it can cause from a lung standpoint, from a heart standpoint. No need. We hopefully know all about the risks. But as a plastic surgeon, I think about wounds. I deal in wounds, right? I make wounds, I close wounds. And what do wounds need to heal? Oxygen, blood supply. Nicotine and tobacco is one of the worst offenders for the delivery of oxygen or blood to tissue that needs to heal. It's horrible for wound healing. Whenever a patient comes into my office and there is a history of current tobacco use, the only thing that I can say is you will need to have quit for 6 weeks before surgery and 6 weeks after. And hopefully at that point you're just like, okay, it's not worth it anymore, I'm done. Right, but 6 weeks before and 6 weeks after, and we'll verify with the blood test that you are indeed nicotine free. Because if I make a big wound for your breast reduction, for your abdominoplasty, for anything, really, you and I want the same things. We want the wound to heal. Maybe me more than you. If you smoke, definitely me more than you. It's horrible for wound healing. In addition to that, it's horrible for looking youthful. It ages you. Did you know that? It ages you. Smoking tobacco ages you. So what does it do to the face? So it thins the skin. It can cause actinic changes or changes that are associated with facial aging and exposure to the sun, and it makes them happen at a more rapid rate. So typically, if I see a patient who's been smoking for years, what I notice is that they have kind of wrinkles that are more prominent. They will tend to have smoker's lines around their lips. Their lips will be extremely thin. They'll have some sallowness and hollowness in the face, saggy skin, poor skin quality, you name it, they'll have it. Say you've stopped smoking and you realize this because personally you look older than you think you should look because you smoked for years. What can be done to address all of the changes that are associated with quicker facial aging as a result of smoking? I can say that there's not just one problem, right? And so there's not just one solution, unfortunately. But let's start with kind of the least invasive and go to the most invasive. Things like wrinkling of the skin, actinic changes of the skin, smoker's lines need to be addressed in roughly 2 ways. One is that you actually need to fix the depressions and the furrows that are in the skin. That could mean things like a facelift, things like an eyebrow lift. But for smoker's lines, a facelift is not going to address the lines around, the tiny wrinkles around the mouth. So when I say fill in those wrinkles, I literally mean fill in those wrinkles, right? So you either using filler or fat to actually add volume where you have wrinkles. That's one thing that needs to be done. Then you also need to resurface the skin, meaning take away all the bad looking skin and replace it with skin that looks more youthful, has more collagen, has more elastin, is better quality. So typically when I say resurfacing, that means laser of some kind. So the usual lasers are things like microneedling, radiofrequency microneedling that we see in the Morpheus. They are things like profractional laser, either using carbon dioxide, CO2, or erbium. Those are the things that you need to do to be able to resurface the skin. What they do is they create tiny pores into the skin that kind of demand from the skin to recharge and refresh, basically. And that would be a second step. The third step would be not only to restore the volume in the individual wrinkles, but restore the volume in the entire face. So what does that look like? That looks like potentially using filler, but in my personal preference, I prefer to use fat that we harvest from the body. It's your tissue. It's pretty semi-permanent. And as long as you don't change weight, you won't lose the fat. So strategically putting fat in places that restores natural volume and gives you, again, that more youthful fullness that we see as we're younger. And then how many is that? That's 3? Right. Number four would be a facelift. Absolutely. To address any sagging of the skin that will inevitably happen as a result of facial aging, but especially premature facial aging like we see with smoking. Other things that you can do include a lip lift. A lip lift helps to shorten the lip, and actually a shorter lip is associated with youth. The older that we get, the longer the lip becomes. And when I mean the lip, I don't just mean this part, I mean the entire part from the base of the nose down to the lip. That lengthens. How can you tell at home if your lip is longer than it was when you were younger? So, I want you to smile. Those of us with big lips will have to bow out of this conversation because I don't have what's called gum show, meaning that if I were to give you a smile, you wouldn't necessarily see my gums. But typically, women in particular should have gum show, right? About 2 millimeters of gum show is considered to be appropriate for women. If you have more than that, you have what we call a gummy smile, and there's a way to address that. If you have less than that, then your lip is probably longer than what is considered attractive. If you no longer have gum show, but you used to, then probably your lip has lengthened over time, and you should consider, if that bothers you, a lip lift. So these are all the tools that we use. What do you think? Leave your comments and questions below. As always, love you lots, and bye for now.